Hello, everyone, and welcome to tonight's episode of Navigator Nuggets. I'm your host, Dr. Nicole Rochester, and tonight we are talking about the coronavirus vaccine. I'm sure that you all have heard a lot about it, and you may be tired of hearing about it, but it is here. The virus is here. The virus is not going anywhere, and as you all know, it continues to ravage not just the United States, but the entire world. And so the importance of the coronavirus vaccine cannot be overstated. And I know that there are a lot of concerns and a lot of dismay. And so I am so happy that one of my friends, one of my sorors, and just a very, very trusted person in the community has agreed to talk with me and talk with you all today to share her own story about her journey going from being hesitant to get the COVID vaccine to wanting to get the vaccine. So welcome, Latrice, and thank you again for joining me. And I just, if you could just kind of share a little bit with the Navigator Nuggets audience, a little bit about who you are, and then we'll just go ahead and get started.
Thank you. I'm happy to be here. And I am Latrice Rogers, and I'm an educator. I work in the district office. And so I interact with staff mostly, but also I visit schools at times and I have occasions to interact with students. And so in that role as an educator, we recently learned that we would be eligible to receive the vaccine. We are in the 1B group. And when I received that news, I really had to think about what I wanted to do. I needed to make a decision um, so that I could be ready to move when, the vaccine is going to be distributed. Um, so a couple, I don't know how long ago it was, but maybe was it, I don't know if it was December. I think it was December that you had the first webinar. It could have been November, or the live that talked about African American community in particular, and them being reluctant to receive the vaccine. And so I participated in that one, and then you had a follow-up one that gave more information. So that's kind of who I am. And I'm also wanted to just say I'm also the mother of two young adults, and they both live with me currently. So that's an important factor because, it impacts them as well.
Absolutely. Thank you. Thank you for sharing that. So I want to share some statistics about the pandemic, and then I'll just, we'll just have a conversation. So today, you all, we're taping this on Sunday, January 31st, 2021. And as of today, there have been 26,178,803 cases of coronavirus in the United States. 26 million. And there have been 441,282 deaths. And before we started recording, Latrice and I were just talking about, we remember when it all first started, less than a year ago. And then we remember crossing that 100,000 mark. And I remember feeling like, oh my gosh, we have crossed 100,000 deaths, and then 200,000, and then very recently 300,000. And now here we are very quickly approaching 500,000 deaths. You all are aware that there are now 2 vaccines that are available via emergency use authorization by the FDA. One of them was developed by Moderna, and one of them was developed by Pfizer. And the data for both of these vaccines is readily available. So if you are somebody who really wants to get down in the nitty gritty and look at the numbers and look at the data for yourself, I encourage you to go to www.fda for Food and Drug Administration, fda.gov, and you can just search, vaccine approval or Moderna or Pfizer, and you'll be able to pull up that information for yourself. So right now we have 2 vaccines that are available. Both of them have been proven to be extremely safe. In the trials, there were over 70,000 individuals who were in the trials for the Moderna and the Pfizer, and about half of those got the vaccine. So the way the trial works, and I've talked about this in previous episodes, But about when you have these trials, half of the people get the vaccine, and then half of the people get a placebo, which basically means sugar water or salt water, and then they watch them. And so they did that. And in these vaccine trials, there were no serious adverse events in either of the trials, Pfizer or Moderna. So this vaccine was proven to be safe, and it was proven to be effective. And so in the Moderna trial was about 94% efficacy, and in the Pfizer trial was 95% efficacy. And what we mean when we say that, and this is also important to know, is that in these trials, what they were looking for is serious disease or symptomatic disease from COVID. So they were looking to see, did anybody get sick? Did anybody have to be hospitalized? Did anybody die? And this vaccine was proven to be extremely safe, 94% again in Moderna, 95% in Pfizer. And just as a comparison, the flu shot that many of us get every year, and I know not all of you get it, but many of us get a flu shot every year. The efficacy for the flu shot is like 60 to 70%. So, this vaccine everyone was thrilled. Like, people in the science community were thrilled with the results. However, there are some valid concerns, and that's what Latrice and I are going to talk about today. I think in general, Americans have expressed, really from when they first started taking surveys over the summer, before they were even approved, Americans were expressing some concerns. And I think initially there was maybe 50% of Americans were saying they would get the vaccine, then it went up to maybe 60. But now, we're at the point where a majority of Americans are saying, yes, I want to get this vaccine. And in fact, in the last few weeks since the vaccines have been released, there's like this huge dichotomy where you have the non-Black, I'll just put it out there, you have the non-Black members of our communities are, like literally standing in line, getting up early, getting on the websites, writing their community leaders and, local legislators and paying people and skipping the line and doing some unethical things to get this vaccine. And then we have Black and brown people who, for a large part, are sitting back saying, I'm going to pass on this. Some people are saying no, period. And some people are saying, no, not right now. And I just want to acknowledge, as I have in previous videos about this, that concern is valid because of all of the historical abuses and mistreatment of Black and brown people by our healthcare system. So I do want to start out by acknowledging that, and also acknowledging the fact that, it was called Operation Warp Speed. I mean, that probably wasn't a good name. And so it gives this connotation that things were done quickly and maybe haphazardly. And this is new. Well, we're going to talk about it. It's not really new technology, but it's new to us, like us that aren't working at the NIH and doing these types of, doing this type of research. And so the vaccine itself is new, and it's under emergency use authorization. And so the trial is still ongoing, but the reality is that there's still a lot that we don't know. So with all of that, not being able to really tell people what's going to happen to them 6 months from now, a year from now, 3 years from now, there's a lot of angst, particularly in the Black community, in the Latino community, Native American community, communities that have historically been mistreated by doctors and other healthcare professionals. So I do want to share another statistic about the vaccine. As of today, I believe this is from today, 29,577,902 people. So almost 30 million people have received one of the two vaccines in the US, and globally, about 94 million people have received the vaccine. And I'm saying that now because for those of you that are saying, I don't want to be first, you are far from first. There's 94 million other people that have already gotten this vaccine. So with that being said, the reason I asked Latrice to join me today is that Latrice reached out to me today, and she and I had a brief conversation. And why don't you tell them, Latrice, what you told me, and then we're going to go all the way back to where you started and where you are today.
Yeah, so I reached out and called Nicole to tell her that I wanted to thank her for providing the information that she shared in her live videos, because it was really helpful to me in terms of making the decision to go ahead and get the vaccine. And so I just wanted to express that gratitude to her, because I don't think, I'm pretty sure, in fact, I probably would not be getting the vaccine if I had not had that information, because I don't think it's something that I would have sought on my own. I would have just stayed in my beliefs that I've held for a very long time when it comes to vaccines in general. So I don't know if you want me to.
Yeah, so we'll take it all the way back. And I was so excited when Latrice said that. And I also want to shout out my friend Sharon. She knows who she is, because she also sent me a similar text a few days ago. And this is not to brag, this is not to say like, oh, Nicole's amazing because she's getting some of her friends to get the vaccine. No, really, the reason I wanted Latrice to share her story is that one of the things that I have been telling healthcare leaders is that we cannot overestimate the power of just one person, sharing their story, one person posting on social media or having a conversation with their husband. Of course, we have to do the big publicity campaigns and all of those things. And every state is working on those types of things, but we can't underestimate what one conversation or what one social media post can do. And so I was just so touched by Latrice reaching out, and I was like, okay, I got to get her on Navigator Nuggets. So Latrice, tell us, you mentioned some long held beliefs that you have about vaccines. So can you share with us how you feel in general about vaccines, and maybe some context about why you feel that way?
Yeah, so I have not been a proponent of vaccines in general. So I remember when my kids were young, and at the time, my husband and I were having conversations about, the vaccine, and he held the same beliefs, probably even more firmly than I did. And it is in a historical context. Many of us are aware of history and how African Americans were given vaccines, but it ended up being that they were exposed to different diseases or experimented upon without their knowledge. And, even like Henrietta Lacks, her cells were taken without her knowledge, and they're still being utilized today. So all those kinds of things, and growing up in Baltimore and being near Johns Hopkins Hospital, and just knowing that they're have this reputation for experimentation. And I had personal experience with that myself. So that's part of it, because, I have some real life experience with it, as well as just a general history with interacting with different doctors, and how I've been treated, in certain circumstances, for example, not acknowledging when I know my body and I'm expressing certain symptoms, and it's not looked upon as something serious or something to really be considered. And they may just say, oh, I'm going to prescribe this medication, but I'm not coming for medication. I'm coming to find out what is wrong with me, because I know when there's something wrong with my body. And so just different life experiences have led me to have this belief. So, it was something that we were really challenged with when they were young, because there are required vaccines in order for them to go to school. I mean, you can object to certain things, but by and large, most people understand that there are required vaccines. So it was a tug about that. And so, ultimately they did get the required vaccines, but anything beyond what was required, we did not do. So for example, when it got time to say, oh, they need to get the chickenpox vaccine. No, they don't. Have it. I got the chickenpox. I survived. We'll just, we'll cross that bridge when we get to it. But, there are certain other vaccines that would have been introduced, like saying you need to have this. And I'm like, no, we don't need to have that. So that's been my basic belief. It's like, okay, I'm going to go because it's required, but otherwise I would not do it. So I personally don't take the flu shot.
Mm-hmm.
I will risk getting the flu over taking the flu shot. And so, and that's not, so like, my mom gets the flu shot. So it's not like I'm doing that because that's just a personal decision that I've made. And I have had the flu before. I actually got it a couple of years ago. It's not the best thing, but thank God I survived. But it's just a decision that I've made based on that history. So that's kind of where I was. So
yeah, wow, that is very. See, I'm learning some things about you that I didn't know, because I didn't know that you generally had concerns about vaccines. Go specifically related to the flu vaccine. Can you share a little more about, like, did you have a specific objection to that vaccine in terms of like whether you thought it was safe, or was that just, like you said, everything that's kind of already happened to you and your knowledge of the healthcare system, and really just not wanting to get anything that was not absolutely required?
yeah, so it's more about that. So it was more about, you know, just not having that level of trust, and not getting anything that's not required. So if you don't tell me that I have to do it by some regulation or law, then I'm not doing it. And so
Wow.
that was my thinking. And also a lot of times I think there are certain like myths, maybe they could have been factual, but then they get misconstrued over time. And I just didn't take the time to do the individual research, on a particular vaccine. And so it's just been like, stay away, I'm not going to do that. So for example, with the flu vaccine, I have known people to say, you actually will get symptoms that are flu-like after taking the flu vaccine, because they're injecting you with the virus. So
Mm-hmm.
I'm like, that's stupid. Why would I do that?
That does sound stupid, doesn't it?
You know what I mean? So it's like, if I'm feeling fine, I'm not going to go get injected just so I can avoid getting the flu. So anyway, that's just been my, firm belief that I've held. And so
Yeah.
that's
No,
just,
that's very helpful. And I just want to point out, I know Latrice has at a minimum a college degree. Do you have any advanced degrees, Latrice?
yeah, I have a master's degree.
That's what I thought. So I'm putting that out there because, and you guys, I mean, Latrice is a very well-educated woman. She already told you she's an educator. She has moved through the ranks and she's now in administration. And the reason I say that is that some people erroneously make these conclusions that Black people who don't want to get vaccines, or Black people who shy away from the healthcare system in general, are somehow uneducated. And I mean, Latrice has already shown you all that. Nothing could be further from the truth. This is not a matter of education. This is not even a matter of socioeconomic status. I mean, this is a matter of mistrust. And she shared that she's had some personal experiences in addition to all the historical things, and growing up in Baltimore and having that history with Johns Hopkins and Henrietta Lacks. So I really appreciate you sharing that. I do have another question about the flu vaccine though. So you said your mom gets it. So my question is, seeing your mom get it every year and seeing that she's okay, I'm assuming that she hasn't had any serious reactions, did that in any way influence your decision? Or was there ever a time when you thought, well, my mom is getting it, she's okay, and I have some other friends that get it, so I'm going to go ahead and get it this year?
No, because my mom gets it because she has a pre-existing condition.
Got it.
And so like, I feel like for her, it's required.
Okay. So you
know
kind
what
of
I mean?
consider yourself
So like,
low risk.
yeah.
Okay.
So that's why, I'm like, well, I don't have that. So I think I'll, be okay if I have to get the flu. It's not the best thing, but I'd rather take my chances. So I think that's why, like in my mind, even though, I know it's not reality, but it's like, to me, is more necessary for her.
Yes.
She's older and she has pre-existing conditions. So, I really wouldn't want her to get the flu because, her chances might be, she might be more severely impacted if she has the flu. That's what
Absolutely.
and I feel like, I'm healthy, generally speaking, I'm younger and I can, you know, probably handle it a little bit more.
Yeah. And that's important because, when we're making decisions, whether it's getting a vaccine, whether it's having a surgery, whether it's taking a medication, many of us, we're weighing the evidence. We're weighing how risky we think that particular thing is versus how likely we are to either, what's going to happen to us if we do it, what's going to happen to us if we don't do it. And so you made a calculated risk decision where you decided based on your age, based on your health status, that getting the flu would probably, even though you had the flu and you said it wasn't fun, but you like you said, you survived it. And so it sounds like you're saying you decided that you'd rather chance getting the flu, something that is a known entity that's not a walk in the park, but you're thinking you're at very low risk of dying from the flu. And so therefore, why get a vaccine that you're not all that sure about? Am I
Right.
summarizing that correctly?
Yes. Yeah, that's exactly.
Okay. All right, excellent. And I mean, that's definitely those are the same kinds of conversations that people are having about the coronavirus vaccine. I will share that I had a 3-hour Zoom call with my family last weekend. We didn't intend for it to be 3 hours, but and that wasn't even just us, I mean, we were having a little fun, but it was mostly like just serious talk about COVID and the vaccine and me trying to share information with them. And one of my nephews, who is under 30, basically said, well, I have a lot of friends that have had COVID and none of them got really sick. Some of them, all they had is a little sore throat or a little stuffy nose, or maybe they lost their taste and smell. So he kind of had a similar argument for not wanting to get the vaccine. It's like, well, I'm young, I'm healthy. A lot of my friends have already had it. It's not a big deal. So why would I put, something in my body that is experimental? So, I mean, I just want people to understand like all that goes into this decision. Okay. So flu, you're still a no for the flu shot for now? Okay.
Yes.
So now, so tell us about like when you first started hearing that there was going to be a vaccine for coronavirus. What were your initial thoughts about that?
So it was a hard no for me. A hard no. Sorry, my dog is.
Oh, that's okay.
I don't know if you can hear him, but
it's all right.
Yeah, it was a hard no, and I didn't even like consider it. Basically, it was like, that's good for them, but I'm not doing that.
And was it a hard no for the same reasons that you shared about the flu vaccine?
Yes, and even more so, I thought of things like the Tuskegee experiment. I'm like, yeah, they're not going to be injecting me with anything, so it was just, I didn't even consider at the beginning getting it. I was just like, oh, that won't be me.
Do you know anybody personally who has had COVID?
So now I do, so more recently, I would say in the last maybe 6 months of this. So at the beginning, I did not know it. But then, it just started getting closer and closer and closer to home. And right now it's real close. And so, it's definitely something that has been evolving in my mind over time because of a number of factors. So, like I said, you were the ultimate factor. So I know you didn't want to toot your own horn at the beginning. You're like, you didn't have anyone to say you're amazing, but you are.
Thank you.
Because I'm telling you, I don't think I know I wouldn't have made that decision if I had not been exposed to the information. But it has gotten closer. And I do know of one for sure confirmed death as a result of COVID. And another one I suspect, but they haven't, no, they didn't reveal what the cause of death was.
Okay.
We just suspected that was the case, but I don't know for sure. And so, yeah, so it's definitely evolved in terms of getting closer, more personal. Um, so it went from that hard no. I started to see, people that I knew with it. Or first it was like one person removed, a friend of a friend kind of thing. But then it became, even more personal. So as I saw that, I was like, well, maybe I'll consider it. But it won't be anytime soon. It was still like a far way off proposition. Okay,
Yeah,
I'll wait to see what happens to other people first.
got it. When you were a hard no, before COVID kind of got closer to your personal circle, and I'm sorry to hear about those deaths. Did you did you did you hear any information about like the trials, or do you feel like you had an understanding of, like what was done to kind of make these vaccines get emergency use approval? Do you feel like you had an understanding about that?
Yeah, I feel like I had a general understanding about it. I understood, particularly because I know like the timeline was an issue. People
Mhm.
saying felt like rushed and they didn't. So I did have some information that was counter to that. So I did understand, like in the scope of things, that some of the information that was being shared was not accurate per se. And that I don't mean from the experts, I mean from just people on the street, like people
Yeah,
you and then there became like a lot of conspiracy theory types of things, that were just outrageous. I'm like, they're not inserting us with chips,
yeah,
all kinds of things floating around out there. I mean, not to dismiss other people's beliefs, but for me, I was like, no, I know that's not something that I believe. So that wasn't a deciding factor as to whether I was going to get it or not going to get it. So it was still, just what I shared with you before.
okay. So you went from being a no to being a I'll wait until later. And so what was later going to look like for you? Like in your mind, had you thought about when later was going to be?
Well, at the time, I thought it would be at least a year out. And just in my mind, there's no real rhyme or reason. I was just trying to project, like, oh, at the time I thought I could see an end in sight to COVID. So this was before October, right?
Yeah.
And so you know how you keep thinking, oh, by the end of the year, we're gonna be in better shape. And so it was almost like yeah, when it starts to be in better shape and then people are getting vaccinated, give it about 6 months or so to see what happens. And then I might be ready, in the fall or something like that. So that was kind of my thinking.
Got it. So walk us through, what did I say or what did you learn that got you from that I'll maybe get it later to yes, I will get it when it's offered to me.
Yeah, and so like I think that simultaneously when it was getting closer, because I started to see people that I knew impacted, that's when you had the first live that I saw that I participated in. And that one was really about the mistrust. And so in that, you validated people's mistrust of the healthcare system in general and vaccines specifically. And there were a lot of people who had different beliefs on the call, but there were a lot of commonalities as well. And so it was just affirming that what I was feeling wasn't wrong necessarily. So it wasn't like a value judgment.
Yes.
Like you're just confirming, that my belief is valid. Everybody has their own valid beliefs for whatever reasons that they have. So that made me a little bit more open to consider, it. You know what I mean? Because it wasn't like you should definitely get it, because that's been like the general, with vaccines. Like I gave that example with my kids. They're like, now it's time for them to get the chickenpox vaccine. Like it's not an option. They didn't.
Yeah.
You have a choice, but I'm educated and I know I have a choice. And I just think about people who may not know that they have a choice and they just go with it because they're telling you now it's time for you to get it. And so I didn't want it to be that kind of thing. You know what I mean? This is before they're rolling it out. I didn't know what it was going to be. There were some myths and rumors about that, saying, that there might have been some mandates in place that people would be forced to get it and that kind of thing. So, I didn't know at the time what to expect exactly. But that first call was just like, maybe I'll think about it, And you also provided some statistics about the efficacy piece. So just knowing that, and so, for example, I remember one thing specifically is that I didn't realize the low efficacy in other vaccines. So I knew they were saying, oh, this is 90+%. But I didn't realize on the flip side, you have vaccines that are only 60, 70%, So that was one fact that you shared that really made me, is that so? So I was like, let me look into, that part of it. And that made me think about it more, to say, oh, this might be something I really should consider.
Awesome. And then so that was the first video. And then what moved you along to, continue to kind of think more seriously about getting it?
Yeah. So then by the time you did the second one, you were just coming with all the facts. You were just like this, that, this, and I was like, everything you were saying, I was like, wow, yeah, this is good. I think I can do it. I think I can do it. But it was just like, you can't, you had done your research and you presented it in a way that made me feel more comfortable being open to receiving it. And then just the fact that we already have a relationship and I trust you. So I'm like, I trust you. You've done your homework and I'm glad you did, because you did it for me. I didn't have to go out on my own and figure it all out. And because you're a person that I trust, I'm like, well, if Nicole said that this is what it is, then that's what it is. So it's something I definitely, would consider. So it came to the point where, like I said, when they said, oh, as an educator, now you're in that 1B. So for us, I'm in Montgomery County. They have not started yet with the 1B. Hopefully we'll hear something this week. They sent a message out last week, just basically saying it's coming.
Mm-hmm.
And so at that point was like the deciding factor. So I walked away from the second one with a strong, yeah, this is definitely a possibility for me. I wasn't exactly yes, but I was more open to it. Before I was completely closed. I was like, nope, no. And so I was at least more open to it. So then, like I said, when they sent the first message, which was a little bit over a week ago now, maybe about a week and a half ago, I was like, I need to decide what I'm going to do, and I was just kind of weighing things in my mind. And these are the things that I've already expressed here, but it was like the risk and the benefits. So I just felt like the benefits would outweigh the risk at this point. Because although I'm younger than my mom, I'm still not under 30, like your nephew, right? Or your cousin. So I was like, yeah, and it's impacting, my age group as well. And so, and you get over a certain age and you start to think more about your mortality in general. And so, because, I've lost people not related to COVID within this last year too. And so, and it was like a vibrant, healthy, and then they're not here anymore. So, it's not something to take lightly. And because of those factors as well, it was like, as I played it in my mind, like I said, it was just a matter of, now that I have this information and I can determine that the benefits outweigh the risk at this point. And so I'm just going to do it.
That is awesome. Did the post that I made, so I got you all that are watching, if you haven't already seen my post, I got my first dose last Tuesday on the 26th, I believe it was, of January. I got Pfizer. I would have gotten Moderna, whichever one they had, I was getting it. But I did post on my social media about my experience with the vaccine. And I'm curious, Latrice, if you already made a decision by the time I posted? And if so, or even if not, like, did those posts do anything to make you feel more comfortable about getting the vaccine, or it didn't really, at that point, you had already made up your mind?
Yeah, I had actually just decided, because that's about the time that we received that message from, from our human resources department about it's coming. So yeah, it was like probably the day before or something like that that I got the message. So I had already like just decided. So then when I saw the post, it just reaffirmed, what I was thinking. So I was like, yeah, this is good. And, she's not having any symptoms. And then I spoke to another person that I know in my Zumba class, and she is a frontline worker. So she got the vaccine a couple of weeks ago. She's actually going for her second dose this week, I think.
Okay.
So, and she's fine. So I was like, I'm starting to see people who are taking it and they're fine, and only hearing minor things around, like, for example, in like a normal vaccine, soreness at the injection site and things like that. So, that did help, but I had already kind of made up my mind, but I was like, yeah, so, it's fine. It's going to be fine.
That's good. Wow. Well, I am thrilled. I'm excited. I'm happy that you've made the decision. Even if you hadn't made that decision, I would love you just as much anyway. And I think, I really appreciate what you said about validating your concerns and not feeling like somebody's trying to force this down your throat. I mean, that's the approach that I have tried to take. Is I really believe that there are some people who strongly believe that this vaccine is not for them, and we have to respect that. We in the medical community have to respect that. And it doesn't mean that I don't want them to get it. It doesn't mean that I don't feel that it's best for them, but I'm not going to badger someone. And I'm also not going to make someone feel badly or feel guilty over that decision. My thing has always been, I just want people to make an informed decision.
Mm-hmm.
So there are some people that are firm no, based on, like you were saying, some of the myths that are circulating, some of the conspiracy theories. And so for those people, it's like, let's talk about those myths, let me help you understand what the truth is. But then once you know the truth, if you understand and you still decide, what, this vaccine is not for me, or it's not for me right now, then, I think that we have to respect that. But for you to, share, I think it's very important that people understand the process that you just described is the process that I think a lot of Americans, and definitely a lot of Black Americans and Brown Americans are going through. And so I'm hoping that it will inform how the healthcare industry, manages vaccine hesitancy and, things like that. Because I think, and I'll be honest, I'm a pediatrician. And so obviously pediatricians are the ones that are pushing vaccines probably the most. And, when I was younger and less wise, I definitely had, I'm just being very transparent, I had very negative feelings about what we label anti-vaxxers, so to speak. Mm-hmm. Because in my mind, with my knowledge, I knew the benefit of vaccinating children, and knew, not that some of these diseases I've never even seen, but I knew the power of, how we've been able to completely eliminate certain diseases. But at the same time, I had to understand, and this has come with age and maturity and growth, that I was coming from a place of privilege. I'm a physician.
Right.
So some of that inside knowledge that I have is not readily available. And I'm within the system. So of course I'm going to have more trust for the system that I work within every day than somebody who's on the outside. And at that time, to be completely honest, I was healthy and I hadn't been a caregiver yet, and my kids were healthy and my husband was healthy. So I really hadn't had a lot of my own personal interactions with the healthcare system, other than me just being a doctor and loving on my patients and their families. So I kind of had this Pollyanna view of healthcare and medicine until, my dad got sick and I started going to the doctor with him. And I was like, what in the world?
Right.
And then my husband had some health challenges a few years ago. And just when I really started to see the true experience of, the patient and the family member, that's when I think that's when I really started to understand. And of course, my George UPS doc is built off of those experiences. But I just think, we need to learn, we, meaning the healthcare professionals, need to learn how to really talk to our patients and their family members. And I think there's a lot of things that people don't do, because this problem is not going to end with the coronavirus vaccine. I mean, there's a lot of burned bridges, and there's a lot of work that the healthcare system is going to need to do to make things right with Black and brown people.
Yeah,
And
I
so
wanted to share.
Yeah, go ahead.
I'm sorry. I want
No,
to share one thing about that based on what you said. You said something. And that is, these campaigns that they're planning and all that for people that I think that are like me, because I'm speaking from also, different conversations that I've had with family members and things like that. That's not going to work. Period.
Say that again.
It's not going to work. Because I'm watching, I see everything they're doing. That would not sway me one way or another, because it's just a continuation of a system that I already don't trust. So you can put out whatever you want to on a commercial or whatever. I'm going to say that doesn't apply to me. You know what I mean? And so I really think, so I feel like they're kind of wasting their money. I mean, not to say they're not going to do anything, but it's not going to target people like me, or a firm no. Seeing a commercial for a person that was a firm no, that's not going to change my mind. I don't care what you put in that commercial. So I think it really is that, I'm hoping, because I know you are, you're still on the road, you have your show on the road, and you're working with healthcare professionals, right? And so I'm hoping that they really take time to listen to what we say we need, right? And so again, it really is that one person view, as opposed to this, we're gonna go on a full blitz campaign. That may sway some, but I feel like it won't really sway, because the people that it's targeting are already planning to get the vaccine anyway. Do you know what I'm saying?
It's like preaching to the choir.
Yeah, it's like preaching to the choir. So how are you going to get the people that aren't in the choir? That's not it. I mean, it's like you need more of a boots on the ground approach. It needs to be like grassroots. And so I did share with you during our telephone call that when I do get the vaccine, I am going to make a post about it. I'm going to share, for the people that I know.
Yes.
Hope that, I can have some influence on somebody who might have been in the same situation that I was in, a hard no. And then, maybe they will reconsider how they move forward. So we'll see, but I'm definitely planning to do that. And so I just feel like you can have more of an impact that way, because if people know and trust you and they see you doing something, it can motivate them to maybe consider, or at least be open to the possibilities. Maybe even they'll want to have a conversation with me about it or whatever.
Yeah, that is incredible. I appreciate that you're going to do that. And I think, clearly that's, that one-on-one interaction, or you seeing somebody that you know and trust post about it helped you. Certainly the same is going to be the case once you post. People in your circle are going to be like, okay, I'm going to consider that. But from a public health perspective, you can understand that, us getting onesies and twosies when, it's going to take 70 to 80% of America to get this vaccine for us to get, the herd immunity, which basically means that, the majority of people are going to be immune to coronavirus, and eventually that thing won't have anybody to jump into and it'll just go away. So that's the dilemma, I think, is like we need to. So my question to you is, they've done studies where, like, who do you trust? Clearly you and I are friends, we're sorority sisters. But my question is, what about your doctor? What about your pastor? What about your county executive? Like, are there other people that you think either you personally or some of your friends and family members would listen to regarding the vaccine?
So I think, it's a challenge to really answer because I'm not sure. And the only reason I say that is, for example, my pastor, he has been advocating for the vaccine, and he actually ended up volunteering to be part of the trial.
Okay.
And he wanted to just be a model of what it looked like. But I remember when he first came on and he said it, I was still a hard no. And I was like, he is crazy. And he should not be using his platform to try to push this on people, right? Even though he wasn't pushing it. That was just my, mentality at the time, because I was a hard no. And I was like, why is he doing that? This is church, you know what I mean? And so he attended Howard University, and so basically that's how he became more aware. So because he went to Howard University, they had spoken to him to try to get him to, do what he did, sharing the information, talking about how it impacts the African American community disproportionately, and the importance of participating in the trial so that they can have, data that would help us as a community. And he actually spoke about it again, recently, and like within the last day or so. And he was not at church, but a separate event. But anyway, but he was saying, the same thing, like he's healthy. He wanted to contribute in some way because he wasn't in the military. He's not a frontline worker. And so he was thinking about what his contribution could be to help with this, disease. And that was his contribution, to be part of the trial. And so it was funny because he actually preached something about it today too.
Yeah.
And I was running in the house. I'm not even gonna lie. Because he was saying, as part of the trial, he was praying for side effects. And he was like, people think you're crazy, but he was like, that way I know I didn't get the placebo.
Yes.
The first time he didn't have any side effects, but the second time he did. And he was so happy. He was like, so I know it's working, and so he just made this context. But basically I was like, yes, so yeah, so I've shifted with that too. So I went from he's crazy to, yes, running in the house. So it's hard to say. That's why I said that, because it's hard to say. It just depends on, I think, where your personal mindset is at the time.
Yeah.
But I did have a thought about what you said in terms of how do you get, I know you don't want the one-offs, but I feel like they could tap into the power of that. So how are you advertising? Are you just you going to some campaign that's going to be like something that doesn't affect me? Like, I'm going to look at it and say, that's not me. But are you going to bring somebody on like me, to share my story in a commercial or something, people know, oh, that person looks like me. I can connect to them. I can connect to their story. I can connect to how they feel. So just being open, honest, transparent, and allowing somebody to share so that maybe you can impact. So it doesn't become a one-off. even though they may not know you personally, but if they can connect with you, perhaps that's a way that you can still reach more people. But I feel like you have to be willing and listening. You can't go with the same old thing. Like, you can't
That's
say,
it.
I know what to do. You don't. This is a new thing, right? So like, you got to try something new, because that's not going to cut it. If you're just going to do a regular advertisement about, oh yeah, this vaccine's great, that's not going to work.
I love that you said that. I mean, you're right. Like, we need to do something new. And the way I see it, again, this is just the beginning. I mean, we're in a global emergency. And yes, we want people to get vaccinated. But I'm hoping that they take the lessons that we should have learned already. Let's just put that out there, because we've known for a long time about mistrust, and we've known for a long time that what's been done to Black and brown people and Native Americans, like, this is not news. But now that everybody's finally ready to hear it, I'm hoping that they take the lessons learned from this and do better, moving forward. And like you said, just and be open and honest and transparent and meet people where they are. And yeah, I think that's important. I did want to ask real quick before we wrap up the doctor part. So, one of the things that they found in some of these surveys, even when they interview Black people or survey Black people, is that generally the physician is still, for the most part, kind of highly trusted, a highly trusted individual. And so if you, and you may, it may be hard for you to answer this because now you're at a yes, but if you think back to when you were a firm no, or maybe when you were a maybe, if you had an encounter with your doctor, maybe telemedicine, or if you had to go in and during that visit, your doctor expressed to you, how important they felt that it was for you to get the vaccine. Do you think that that would have changed your mind in any way?
I think it potentially could have. It would depend on how they tried to get me to, you know, um, consider. So again, like, they always ask me every year, you want to get the flu vaccine? And I'm like, no, thank you. I'm going to pass. But they come at it with the thing that I already have in my mind that I'm saying, it's not going to. So they come at it with the potential risk of not getting it, right? Mm-hmm. And I'm like, well, I've already decided in my mind, I'm going to take the risk. So that's not going to help me make a different decision. So I feel like if they come at it from the side of what are the positives instead of like that deficit mindset, because I feel like they try to kind of scare you into stuff.
Yes.
But I find, even though I love my doctor, but it's always presented in a way that is more on the negative side. Like, if you don't do it, these bad things can happen to you. You know what I mean?
Yes.
As opposed to, here's the benefits of doing it, right? And so I think that's an important factor, like how it's presented, even no matter who's presenting it, it's more about the how it's presented. So I can trust you, but if you had, when you did your lives, if you came at it from another angle, I don't know that I would be sitting here now saying, oh yes, I'm going to take it. You know what I mean?
Yeah.
Because you were, like I said, open, you validated people's feelings about it. And it wasn't like seen as a negative if you didn't want to do it, And so like a doctor can sometimes make you feel that way. Like, you're bad for not wanting this, even though you might have a good relationship with your doctor.
Yeah. That's a really good point. Wow. I feel like we need you on some of these subcommittees and workforces. Don't be surprised if you get an email.
Don't call me.
I'm serious, because your perspective is so valid, and it represents what most people are feeling right now. The last thing I want to ask is that, for me, because I also, like I said, I wasn't a hard no, but I was definitely I'm going to get this later. And that's me as a physician and reading all. And then as I learned more and, I got more comfortable. But the other thing for me was just feeling like there's hope, and feeling like, okay, this is the beginning of, I don't want to say get back to normal, because we're never, that normal right. is done. But, I really started to think about the fact that my family and I, we used to get together all the time, of course, on the holidays, but my sisters, my uncle, my nieces and nephews, like we all live, my kids, we all live within like 20 minutes of each other. So we probably would have gotten together at least 10, 15 times, from last year to now,
Right.
had there not been a COVID. And now we're doing, Zoom calls on Thanksgiving and Christmas and people's birthdays.
Yeah. Yeah.
So I guess, when you were a hard no, did that weigh in at all? Or how did you reconcile, I guess I should ask, the decision at that time to not get the vaccine with the fact that, the knowledge that may mean that, you're not going to be able to safely gather with your family? Or was there even any connection between those two?
At the time, there wasn't a connection. I kind of think I compartmentalized it. I just put that in a different, it wasn't even like connecting, because I was thinking more globally, I think. So I was like, those other people are going to get it, then we'll be fine. You know what I mean? Like,
Yeah.
enough of those other people get it, we'll be good. That doesn't mean I have to do it. I'll be in the 30% that doesn't, or the 20% or whatever. You know what I mean?
Yes.
And I was like, yeah, if most of them get it, we'll be good. And that's kind of how I reconcile that in my mind, because, as you know, I'm close to my family as well. And that's been very tough, And like, even my mom the other day, yesterday, I think she posted a picture of my brother and I, and she talked about how she missed our smiles and hugs, kisses, and so we had to get creative on Thanksgiving because she had to cancel Thanksgiving. And we did a Zoom, and I was so sad. I mean, I was like depressed. My kids cried. Well, not my son, but my daughter cried. My niece and nephew cried, real tears when they made the announcement. But it ended up turning out better than I expected, because my brother convinced my mom to still cook for us.
Yes.
And we did a drive-by pickup. So we picked the food up, and then we went home, and then we scheduled the Zoom, so give us enough time to get back home. And then we scheduled the Zoom so that, we could still have dinner together. So it turned out really nicely, but it's not the same,
Yeah.
I couldn't hug her, couldn't kiss her, yeah, so it's been different. But now that's something I'm really looking forward to, is the return to being able to have face-to-face with my family, my friends. I miss my friends. Like, I miss you. We were supposed to go to lunch.
I know, I miss you too.
So, things like that, I'm definitely looking forward to. Traveling is a big thing. I had to cancel several trips last year, including a big one, that, we cried about that too.
Yep.
So, so I'm looking forward to at least being able to do some things in person again,
Yeah.
So
Me
I hope
too.
it happens. When I say it, I mean enough people getting vaccinated that we can start moving the needle in the opposite direction.
Absolutely. And on that note, I do want to, just to be responsible, and you already know this because you're alluding to it, but I just want to be clear for people watching the video that I got my first dose. I'm going to get my second dose next month. Latrice is going to get her first dose really soon. But even after we've gotten both of our doses, we still can't just go out and hang out and take our masks off and, do all those things. We have to wait until, the majority of Americans get vaccinated. So, I do want to say that just in case there's any confusion. Well, Latrice, I cannot tell you how deeply I appreciate you being willing. I mean, this was impromptu, you all. Like, Latrice reached out to me this morning and I asked her and she said yes, and here we are. So I really appreciate you taking the time. What you have said today is so valuable. Like, I don't know, I'm gonna have to talk to you offline because I really want to get your permission to share this, not only on my Your GPS Doc page, but I just feel like some of the healthcare leaders that I'm working with really need to hear what you have said. But I just thank you so much. And if you have any closing thoughts or advice either to the community or to healthcare leaders, I want you to end this broadcast.
well, well, thank you. I just want to say thank you for the opportunity. Thank you for sharing, your knowledge and the information. And I would just say, just basically, encourage people to listen, um, check the facts, kind of try to find information out for yourself. Um, Try to talk to somebody that you trust, you know, and just be open. Just be open to the possibility, because it does matter, you know. Um, Lives are definitely being lost, and we want to be able to, like I said, move the needle in the other direction. So that's basically all I want to say.
Awesome. All right. Well, thank you again, Latrice. Thank you all for watching. This is a very, very special episode of Navigator Nuggets. We'll see if you all are in my circle and you something that either I've said or something that one of your friends or, anybody, reach out to me on social media. You can send me a DM, and maybe, I'll feature more people like Latrice, because I really just want to talk to real people, especially if you have gone on that journey from, not wanting to get it to getting the vaccine. I would love to hear from you. And so that's it. We're going to close up again. Thank you, Latrice. You all, if you want more information about Your GPS Doc, you can go to my website, which is www.yourgpsdoc.com. That's yourgpsdoc.com. You can also find me on social media, on Instagram, Twitter, and Facebook at Your GPS Doc. And I will see you all next time. Thank you, Latrice.
Thank you.